We are dedicating today to talking about the most perennial, perhaps, of all America's problems, its healthcare system. My guest today is Halle Tecco, who is a longtime health innovator, executive, investor. She teaches at Columbia University, and she has a new book out. It's called Massively Better Healthcare: The Innovator's Guide to Tackling Healthcare's Biggest Challenges. Later today, we're also talking to another healthcare expert, Robin Blackstone, MD, who has a new book out called Dr. AI. But first, Halle Tecco, who is talking to us from London, where she now lives. Halle, is it fair to suggest that healthcare is the central or the most, shall we say, symbolic problem in America? It somehow encapsulates every other problem.
Yeah. Yes, in many, many ways. I think it highlights inequality in this country. It highlights the corporatization that we face in a lot of industries that does not always make things better. And as Warren Buffett called ballooning healthcare costs a hungry tapeworm on the American economy, healthcare expenditures devour nearly a fifth of our nation's GDP, which crowds out funding for other democratic foundations like education and infrastructure, social programs that we could invest more in if we didn't have to spend so much on healthcare.
And what about shall we call it the private bureaucratization of healthcare? My experience is just somebody else in the system as a patient. We're all patients within the American healthcare system, is of this multi-layered bureaucracy, which may not exist at the state level, but certainly there's a kind of Kafkaesque quality to it. They seem to be the only industry, for example, these days that still uses the telephone. They won't touch the internet or email. There's something profoundly archaic and reactionary about the industry. Is that fair?
I think that's fair. I do think that's changing, and that changed quite a bit over COVID. I think health systems have previously notoriously been very slow to change. We spent $35 billion as a country in incentives to convince providers to go digital and adopt electronic health records. This is because we could not get them to do it otherwise, even though it was obvious that every other industry was digitizing. Healthcare was the last to hold out, and we had to literally pay doctors and penalize them for not doing it. So yes, traditionally it has been just very slow to adopt innovation. I think the do no harm mantra has just caused a very cautious personality amongst people who work in healthcare. But something changed during COVID. And what we saw was adoption of things like telehealth, remote patient monitoring, remote virtual clinical trials because of necessity. And it happened overnight. Progress that would have otherwise taken years. We saw health systems, clinics set up very quickly. And I think what happened was they recognized that, hey, we're actually pretty good at this tech thing. We're pretty good at vetting potential partners. And they had a real culture shift. And so now there was a report by Menlo Ventures a few months ago that showed that hospitals are actually leading adoption, not just for the healthcare industry, but across many industries. And so the fact that now we are looking to hospitals to really lead adoption of AI is remarkable and not something that I ever would have guessed could happen.
No, that's good to know. I'm going to tell my own doctor next time they bother me that on the phone that there are other ways of doing it, and perhaps some leading healthcare people are doing that. Seems to be something of the Rorschach test about healthcare, Halle, in the US. From the left, the criticism is always too much private enterprise, not enough public control or authority. And from the right, there's too much public investment and control and bureaucracy of the healthcare system. Is that fair? It seems from a critical point of view, it's both excessively private and excessively public. Is that the wrong way of thinking about it?
Gosh. It's funny how we can argue over these things as political when at the end of the day, like healthcare, it shouldn't have to be political. We should all be able to look at the numbers and agree that this is not sustainable and that whatever we've been doing is not working. And Democrats have had their chance and Republicans have had their chance, and it's only gotten worse. So I would say, if it is it too public or too private? We've seen issues with private equity. I have one of my students doing a project right now that's a literature review of all the studies on private equity in healthcare. And the results are pretty damning when when private equity takes over nursing homes and outpatient clinics. You do see prices rise. And in some cases, you see quality lower. So there's some issues there that we need to address. And again, it's not all private equity, but this data is showing the obvious. On the public side, I think that we're seeing now cuts to Medicaid at a level that we haven't seen before. Our safety net is becoming weaker. So I wouldn't say we've invested. I don't agree that with anyone that says we've invested too much. I actually think that we should invest more in public health. Because there's no other way to solve some of these problems than collectively together as taxpayers.
So I take your point on it not necessarily being a political issue, but as you just suggested, the fixes to this, and your book is a book on fixes. It's not a critique of the American healthcare system. It's about how to build a massively better healthcare system. The fixes have to come, for better or worse, through politics, don't they?
Absolutely. Like we have a public safety net. It's just in the wrong place, and we have to move it upstream, because what we're doing is we're paying for folks that fall into a crisis and have to go to the emergency room that are uninsured, or that are on Medicaid Medicaid, or just underinsured, versus investing in them being healthy to begin with. And we have a way to do this. Right now, we're paying for the results of our system not being preventative in nature. The simple way to do this, it's called public health. It's the only part of our healthcare system that is explicitly designed for prevention, yet it's been chronically underfunded. And we've actually seen health expenditures on public health as a share of total health expenditures drop 25% in the last 2 decades. But we know that every dollar spent on public health saves $14.30 in medical and societal costs. So we have an economic case to start investing upstream, but still we continue to just focus on solving the crisis when it occurs. That makes no sense. Politically, it just makes no sense for either side.
This term public health is an interesting one. Does it, though, reflect the cosmic inequalities in the system? I don't know much about your own personal health, Halle, but you look pretty healthy to me. You live in London. You commute perhaps to your job in Colombia. You look after yourself. And the elite in America, the coastal elites, do tend to look after themselves. Whereas those who are not part of the elites, I'm not sure what words we use to describe them, manage their own personal health much less. My question then is, when you use this term public health, is it a euphemism really to describe the need to educate the non-elites in America about how to eat, how to look after themselves, how to exercise?
Partially, I think part of it is just access. So it's actually having access to things like preventive care. And I just want to confirm everything that you just said, because really healthcare in the US is a tale of two cities. And in one, we have wealthy patients, as you mentioned, like you and I, we have access to preventive care and cutting edge therapies. If something were to happen to you, you'd probably go to UCSF and get some of the best care in the world. But on the other hand, we have over 100 million Americans who don't even have a regular primary care provider. And that is actually worsening due to provider shortages. We have Americans who have to choose between putting food on the table or filling their prescription, people who cut pills in half to stretch their medications. There's the fact that healthcare debt is the number one reason for bankruptcy in this country shows that it disproportionately impacts folks that are low and middle income. So yes, absolutely. This is a case of inequality, and health inequity is a huge issue. And just to put one number on it, a person living in a small rural county with an income of $30,000 can expect to live a full decade less than someone who lives in an affluent suburb with an income of $100,000.
It's more than a tale of two cities. It's a tale of two civilizations,
Sure.
which I think reflects and is both a cause and an effect of the
Yeah.
increasing medieval nature of American society, where there are more than one society.
Yeah.
The subtitle of your book, Halle, is The Innovator's Guide to Tackling Healthcare's Biggest Challenges. So you or your publisher uses the I word. You used to live in the South Bay in Menlo Park, in the heart of our innovation civilization, the heart of Silicon Valley.
Yeah.
You noted earlier that one of the problems with healthcare is it reflects the increasing inequality in America. You just talked about that. I'm not really asking you to justify yourself personally as Halle Tecco, but why should we trust innovation experts like yourself? You now teach at Columbia University, another elite institution. You're the founder of Rock Health, a very innovative platform for fixing healthcare. Why should we trust innovators like yourself when innovation itself, or at least the innovation economy, seems to have only compounded American inequalities? It's great for people who use the word. It's great for all of us who travel around the world and go to TED conferences and write books and blah, blah, blah. But for everybody else, it just seems to compound their problems.
I don't know if we're defining innovation in the same way. I think innovation doesn't mean necessarily for profit. I talk a lot about case studies of nonprofits in my book, including tidepool.org and Undo Medical Debt, that are very innovative organizations, but have structured their businesses or their organizations as nonprofits. Rock Health, which you just showed, is a nonprofit. When I think of innovation, I think of something opposite of the status quo. So you're finding a solution and you're scaling that solution. You're not just building something that's going to only benefit you and not grow and scale and impact other people. I really focus on, can you build something that's sustainable and it's scalable? And those things can be done within various structures. I'm definitely not against for-profits. I think in many cases, a for-profit model makes a lot of sense. There's the public benefit corporation, which is becoming more common, and we're seeing this in a lot of healthcare companies, and I profile a bunch of those in my books. So I think there are two different things we're thinking about here. I think innovation just means disrupting the status quo, fixing problems, and scaling that solution. How that's done can be done in a way where you're profiting off of making healthcare worse, or you're profiting off of making healthcare better. And I argue in the book that you have to align your margin and your mission so that you only make money when your mission is accomplished. And that mission is somehow improving healthcare, whether that's lowering costs, improving access, improving outcomes, or improving the patient experience.
Yeah, you certainly, Halle, for better or worse, talk like an innovator, use words like scale. One of the terms that's often used in Silicon Valley, and I'm not suggesting you use this, is win-win. If we can only innovate, if we can only change the system, everyone wins. But wouldn't it be fair to say that in the current dysfunctional healthcare system, there are quote unquote winners? Well, I don't know, maybe insurance companies, doctors, hospitals, pundits who are winning, who shouldn't be winning. In other words, it never is. It's one of the great delusions or one of the great marketing tropes of Silicon Valley. Win-win is never win-win. Check your pockets when anyone uses that term, because someone has to lose for others to win. So who's winning in the current system who shouldn't be winning?
That's a great question. And I would say probably the collective answer for most of us that work in the space and are following closely what's going on would be these large verticalized health plans that now own PBMs and pharmacies. They've become so vertically integrated that they're just moving money from one part of their business to the other. And a lot of this came about because during the ACA, which did a lot of good things, there were also some things that some trade-offs that were made. And one of them was that the medical loss ratio, or MLR. And they basically said, all right, health plans, you have to cap your profits at about 15%. So you can't actually take home profit more than 15% of your premiums. So you have to spend a good amount, 85% of the premiums that your patients pay you, on their medical care. Well, if you're a company that's publicly traded that has to report earnings every quarter, and all of a sudden your profit is being capped, the only way to grow, you can't grow your profit by becoming more efficient. Your only way to grow is to grow the pie. And so what we've seen is that these companies have become enormous. They've become very acquisitive, and they've found ways to pay themselves one way or the other, which is why United is now one of the largest employers of providers in this country. So I would say that they're quite problematic. I think most patients understand. We saw kind of the result of patient frustration with the murder of the Optum CEO, United Health CEO, rather, 2 years ago. And I think us in the industry, we also recognize that the way that this has evolved has not been pro-patient at all.
Is it then, and we've done many shows on this as well recently with my old friend Tim Wu, who was in the Biden administration. He's one of his chief antitrust enforcers, although he's more on the tech side than on the medical side. But is this ultimately then an antitrust issue that
100%.
big organizations like
Yes.
United simply shouldn't be able to grow to the size they are and control all the different aspects of the market?
Yes. Earlier today, I was having a conversation with the COO, who's the fourth generation pharmacist at CO Bigelow. And he was telling me a lot of things that I already knew, but his own experience, where the health plans, they own the PBMs, and the PBMs are responsible for negotiating on behalf of the health plan which drugs are covered and which ones aren't covered. And they are the ones that are also negotiating with pharma to set the prices. So they get rebates from pharma, and then they also are being put out there by the health plan as the ones that are the interface between the patient and the pharmacy, and they're deciding how much they pay. I mean, it's just such a mess, and he feels like his hands are tied because he has to buy through purchasing organizations as an independent pharmacy. So his prices on what he can buy things at are set. And then obviously the price that he's given to actually sell these things are set by the PBMs, who are making money by deciding which drugs they want to cover and which ones they don't want to cover. And so this is why we're seeing independent pharmacies shut. In 2023, we saw an independent pharmacy shut for every day of the year, another one shut. We've seen Rite Aid completely shut down. And let me remind you, Rite Aid, CVS, and Walgreens all shut down thousands and thousands of stores over the last 2 years. Rite Aid completely shut down, bankrupt. They're the only ones that aren't owned by a health plan.
Yeah, it's astonishing. Any aspiring novelists who want to begin a novel about contemporary America, I would suggest you begin at your local CVS or Walgreens in San Francisco. You can't even go into them really anymore because they didn't have any stuff because they
all behind.
Everything's being stolen, and that's perhaps a symbol of what's gone wrong. I don't want to become all political with you, Halle, but of course Donald Trump has started his Trump RX, where he claims you can find the world's lowest prices on prescription drugs. Has RFK Jr. or Trump, have they put their finger on one of the things you're arguing about, this problem of healthcare companies controlling every aspect of the market and basically benefiting themselves in every deal?
Yeah, I don't support this administration, and I think they're doing more harm than good, especially around Medicaid cuts, vaccine changes, et cetera. However, I will appreciate things as they are, and the attention that they're bringing to drug prices is very much needed. The sort of negotiation tactics that they are using with the pharma companies is long overdue, and I absolutely appreciate that. Trump RX is in its very early iterations, and I think that there are some issues with it, including they are only showing the prices of brand name drugs, which might be lower than the brand name prices that they can find elsewhere, but they're not recognizing that oftentimes it's better to take the generic, and the generic will be far less than even the brand name that they've negotiated. I think that's one issue. But I hope that they're able to iron it out, and I will recognize and appreciate progress from wherever it comes from.
I appreciate your honesty. I'm in the same political camp as you, although it seems one of the problems with all these Trump things is that the earliest as what you call the earliest iterations are also the final
Yeah.
iterations. They're all used as marketing schemes for him to promise stuff that he doesn't deliver. Halle, as I suggested to you before we went live, one of our frequent guests on the show is Robert Pearl, who I think is a wonderful, an innovator himself, a commentator, and also a former head of Kaiser Permanente, California-based insurance system. He, and it's probably not surprising, has always presented a network like Kaiser as an alternative to these massive corporations. Is that, I don't want to just turn this into a conversation about Kaiser Permanente, but is he onto something here?
Totally. And I actually write about them or this phenomenon in my book, and it's called a payvider. And it is where both the payer and the provider is one. And it generally has come from providers that then branch out and create their own health plan. But now we're seeing all the health plans that are starting providers, and it doesn't hit the same. There's something about it coming from the DNA of a hospital that has been more successful. We have also Geisinger, which is another great example. My question is, why hasn't this scaled? I think that the care that they deliver is great. They have incredible patient satisfaction. The incentives are aligned. They have a lot less waste. They don't have that administrative bloat because they're not going back and negotiating between the provider and the payer. A typical provider is contracting with dozens of different payers and has to have entire billing offices to deal with that. Kaiser doesn't have any of that waste, which I think it helps them just run a business more easily and cleanly. So my question is, why hasn't that scaled? Why don't we see more of those?
Well, it shouldn't be the question. I mean, isn't that what you're trying to answer in your book? If you can't answer it, nobody can. And I have I have to just chime in as a patient. I've been on Kaiser, and then I shifted because my wife changed jobs, so I had to shift from Kaiser to something else. And I couldn't agree more. I mean, within Kaiser, you're properly looked after. Everyone's accountable. Nothing seems to be wasted. One of the things that's incredibly frustrating for me is just seeing the waste, the money being charged by these doctors for doing so little, the price of drugs and everything else. It's shameful, isn't it? It's like watching endless bank robberies in front of your face.
I agree. And one of my big takeaways from getting my MBA, two big takeaways, but one of them was where there is waste, there is opportunity, and really recognizing and being frustrated by that waste, I think we can use as inspiration and fuel to make change because there's opportunity there.
I should certainly hope so. And of course, out of Silicon Valley, the opportunity now, including Robbie Pearl, is being articulated with AI. Robin Blackstone, MD, as I said, is coming on the show later today. What's your take, Halle, on the possibilities in terms of building massively better healthcare with AI? Is it is it more of the same, or is it an opportunity to address all the fundamental problems with American healthcare?
I'm overall bullish on AI. I think in this exact moment, it is obviously overhyped. And from a deal perspective, there's just so much money flowing into things that are probably not going to work. But fundamentally, AI as a paradigm shift for patients is, in my mind, a good thing. There's been so much information asymmetry that is kind of underlies this like power dynamic that we have within the system where we are not encouraged, we are not empowered to understand, manage, and take control of our own health. So I think I talk about this a lot and just say, doctors are some of them are very resistant to their patients using AI. I don't think that's the right conversation. People are going to be using AI. They're already using it more than we even use Dr. Google to understand our conditions, to ask the right questions. What I think we should focus on is, are these companies like OpenAI and Anthropic, are they going to build the right guardrails so that patients are getting accurate information? There's a company that is basically the Chat GPT for doctors. I'm not sure if you're familiar with it, but it's called Open Evidence. And it's actually only built off of medical journals. So all the results that you get from Open Evidence are all based in evidence. And it cites every sort of claim that it makes so that you can kind of learn more about it. The problem is it's only available to clinicians. And when I talked to the co-founder and CTO and asked, why isn't this available to patients? This would be so much better than what we're currently using. He said, because it'll piss off the doctors. They like that information asymmetry. Some of them really, want to keep this very paternalistic system that we have within healthcare. But I think that to me, that's one of the best uses of AI. But I'm worried about the guardrails, especially around mental health. I think that's an area we obviously have seen people that have been led down paths that are very dark and have committed suicide, have killed people based on these conversations they're having with chatbots, and that's very concerning to me. So I think that we just need to focus on not if people will use it, but people are going to use it. So how do we ensure that people are using it safely?
Yeah, the guardrails issue is obviously very, very topical. You mentioned OpenAI and Anthropic in the same sentence. Some people might suggest they deserve separate sentences, particularly in the context of the way in which Anthropic has challenged the Pentagon on the use of AI in Americans' weaponry, whereas OpenAI, Sam Altman, seems to be much less concerned with guardrails. In other words, what I'm suggesting, Halle, which seems fairly obvious, is that some of these AI platforms are more committed to guardrails than others. Isn't that fair? And that's just the reality of things.
Yeah, I will say that OpenAI has built out a healthcare team, including my co-founder at Rock Health, who's now head of healthcare for OpenAI, and they have a team. I think it's called like the bench, where they've built out the different scenarios, and I think they have committed to guardrails around healthcare. But we shall see. I think we need more researchers that are going to publish data on this. We've seen some early indications of use for clinicians. We haven't seen as much data come out around the use. So unbiased third-party data that's coming out about patient use. Obviously, the platforms are publishing their own data, but what we're seeing is from academics is they're looking at how clinicians are using it. We have tons of data about how clinicians are using it. I want to see how people are using it.
Robert Pearl wrote a book, a famous book, a very influential, controversial book about how miserable doctors are or were. Halle, in your sense, what do doctors want? Do they get the problem? Are they simply reactionaries who want to keep all the power, all the wealth, the choke points in this medical economy? Or are they the ones who can actually trigger the changes? Or again, does it depend from doctor to doctor and specialty to specialty?
I think it depends. I think that there are a number of camps out there right now. I think there's a camp of physicians who are very pro empowerment of patients and they're like, hey, get me a digital twin. I want my patients to be able to get these answers as quickly as they can without me gatekeeping. I think they also recognize that they only have 15 minutes with each patient a year for primary care. We spend more time watching pharma ads on TV than we spend with our primary care physicians. And physicians themselves are very aware of this because they're the ones that are managing multi-thousand patient panels. So I think for the most part, most clinicians are good. I think they want their patients to be empowered and manage their health as much as they can. But there is a group of doctors that like the status quo and like the paternalistic nature of it and have this attitude of like, you do as I say, just don't question me. And I think that those doctors are phasing out because this generation, and especially younger generation, they don't want to accept that. They don't accept the paternalistic nature.
It's more than paternalistic. It's doctors as gods, and being treated as gods and behaving like them. So finally, Halle, I'm going to make you a god, at least for the purposes of this show.
Oh, dear.
I'm going to give you power, massive power, to make a massively better healthcare system in America. Realistically, I mean, we can dream and we can talk about all sorts of revolutions, but you know better than I do that that's not very realistic in America today. Where do we begin? What's possible in the next, you're a Silicon Valley person, so you know that anyone who predicts anything more than 2 or 3 years out is writing or imagining science fiction. Where do we begin in the next couple of years to actually begin to address and tackle healthcare's biggest challenges?
I think we have to fund public health and primary care and ensure that every American has access to basic healthcare.
And what does that involve? Who needs to pay for that, and where will this reform come from?
Yeah. Well, again, we're already paying for it. We're paying for it in emergency room visits. We're paying for it in reduced productivity, unemployment of folks that could work but aren't healthy enough to work. So we're paying for it, mind you. Again, like we just need to move that safety net up so that we're helping people manage their health and wellness and use preventive measures that we know work and have a positive ROI so that we're not paying for it downstream.
Of course, in terms of that ROI, your book isn't too expensive. People could invest in that. But where else can they invest for people who don't know how to manage their health? Where would you suggest they do it?
I think if you're trying to manage and understand the system, there are a lot of great resources that I refer to all the time. KFF out of the Bay Area, which is a Kaiser funded organization, the Commonwealth Fund, they do a ton of great healthcare research. So those are kind of resources that I like as a systems thinker. As an individual trying to manage your health, that is such a good question because there's so much junk science out there. There's so many influencers pushing peptides and other things that are unproven. Eric Topol and Zeke Emanuel
Yeah,
are two.
both have been on the show, Topol and
Yes,
Emmanuel.
awesome evidence-based health and wellness leaders that have written books on this topic, and I'm of their camp. I think that there are obvious low-cost ways to stay healthy that I would invest in before doing the Brian Johnson $1 million Immortals program that he just launched.
And finally, Halle, what about politicians jumping on this issue and making it a defining quality of maybe not just a congressional, but a presidential bid? If this is indeed the problem in America and everyone understands it, everyone has experience one way or the other, should Gavin Newsom, for example, the current governor of the US, who's clearly about to declare a run for the presidency, he knows as much about healthcare perhaps as anyone. Shouldn't someone like Newsom or, I don't know, Pete Buttigieg, another incredibly smart guy who
Yeah.
understands the ins and outs of the American healthcare system, should they be building their campaigns around this?
I think so. And it's kind of been said that we have big healthcare movements every 15 years. And the last one was the ACA in 2010. So it's about time for another big movement in healthcare. So I think the politician that can figure that out can win the hearts and minds of a lot of Americans because most of us are pretty frustrated with what's happening in healthcare.
Although, wouldn't Obama be a warning rather than an answer, an inspiration?
I think that overall, the ACA was positive for America. We have record low levels of being uninsured, removing the bias against people with pre-existing conditions. The fact that a health plan used to be able to deny you to be on their insurance because you had cancer was just, it's crazy to think that we ever allowed that. I think overall the ACA did a lot of good, but I think we have to recognize that there were a lot of trade-offs there.
Good stuff. Very honest from our guest today, Halle Tecco. Her new book, Massively Better Healthcare, The Innovator's Guide to Tackling Healthcare's Biggest Challenges. Don't be put off by the idea or the cult of innovation. It's very down to earth. Halle, congratulations on the book. And as this issue continues to fester or be so relevant for so many of us, we'll have to get you back on, maybe with Robert Pearl. Thank you so much.
Thank you for